Hi everyone, my name is Jenna Dilger. I am a dietitian here at Memorial Hospital in Jasper, and today I'm very excited to talk to you all about healthy eating for healthy babies, the importance of proper nutrition before and during pregnancy. And so today what I would like to leave you with is an understanding of the importance of a healthy diet and lifestyle before and during pregnancy, understanding what foods and nutrients are important for both you and baby, and understanding how to prevent and manage gestational diabetes through nutrition and a healthy lifestyle. So first off, I wanted to talk about one of the most important things that we can do is maintain a healthy weight. A healthy weight before pregnancy can impact your baby's weight at delivery. So oftentimes we found that mothers who are underweight give birth to sometimes underweight babies, and mothers who are overweight can often give birth to overweight babies. And so trying to get your weight under control before you become pregnant can really help with that. Also, a lot of people don't actually realize that being underweight and overweight can affect your chances of becoming pregnant and impact fertility. I think more so we don't realize it with overweight individuals, but it really can impact our abilities to conceive. It also, maintaining a healthy weight decreases our risk for complications during pregnancy, such as high blood pressure, gestational diabetes, C-section, or having preterm labor. Another thing we can do to really help maintain a healthy weight is to start developing a exercise program. And so it doesn't have to be anything super intense, but some moderate activity, walking, riding bikes, swimming. Trying to do that, we aim for at least 30 minutes a day, most days of the week. Another obvious important piece to maintaining a healthy weight and having adequate nutrition for pregnancy is to start eating a healthy diet. And so with that, we want to make sure we're eating a variety of foods from all food groups. And so we want to try to aim to make half of our plate fruits and vegetables, and trying to get a variety of different fruits, a lot of vibrant and different colors, trying to do whole fruits instead of fruit juice, and trying to not just eat corn and potatoes, but try to eat more of our non-starchy vegetables such as broccoli, carrots, cauliflower, spinach, kale, leafy greens. And then another important thing is trying to choose whole grains more often than white grains. So whole wheat bread over white bread, brown rice over white rice, whole grain cereals, oatmeal, things like that. Also trying to include different sources of protein, so not just maybe always choosing your beef or your pork, but trying to incorporate some lean fish, chicken, even beans, nuts, eggs, seeds, or peanut butter as well. And then calcium is going to be very important for pregnancy and baby as well, and that's going to come from our dairy sources. And what we want to do is try to choose our low-fat or non-fat dairy products whenever possible, and trying to limit our intake of sweets, cakes, cookies, sodas, and those junk foods. A couple of things that I feel like we often forget about with pregnancy, or when we're thinking about pregnancy, is things that we might have to avoid during pregnancy. And two of those things are going to be limiting caffeine and trying to avoid alcohol. With caffeine, I feel like that's something that is really kind of a great idea to start limiting right away, because you're going to be tired oftentimes with pregnancy, and so if you're trying to cut back on caffeine at the start of your pregnancy, you might have a more difficult time because you're going to be tired for other reasons as well. And then with caffeine, or with alcohol, this can obviously impact baby's development, and oftentimes we may not actually realize we're pregnant before we get that positive test. And so trying to avoid alcohol from the beginning can really make sure that the baby is going to develop properly. Another thing is that we often don't realize that excess alcohol intake can also affect our ability to become pregnant. So the next piece I want to switch to is the important nutrients that we want to make sure we're consuming both before and during our pregnancy. And one way that we can get this is through prenatal vitamins. And it's often recommended for women of childbearing age to start taking a prenatal vitamin, even if they don't plan to become pregnant. Because as I mentioned before, a lot of times we don't realize that we are pregnant. And if we're already taking a prenatal vitamin, this is one way that we can guarantee a healthy start for the baby's development. We want to make sure we include these vitamins and minerals in our prenatal vitamin, and it's often a good idea to talk to your doctor or your OBGYN about what vitamin might be good for you. We're going to take a little bit of time to talk about each one of these nutrients individually. And so one of the main and most important vitamins and minerals for the early start of pregnancy is folic acid. It's recommended because having adequate amounts of this vitamin can help prevent birth defects that are associated with the spinal cord and the brain. So making sure we're doing this can really help make sure that at the early start of pregnancy that those pieces of the baby are developing properly. And food sources of this are dark leafy greens, beans, fruits, nuts, often in fortified cereals, peas, eggs, dairy, meat, poultry, and grains. So it's in a variety of foods as well, but having it in that prenatal vitamin will just give you that extra support. Iron is also very important during pregnancy because it helps supply oxygen to the baby during development, which is obviously going to be very important. And proper intakes before pregnancy can help make sure that you do not become deficient during your pregnancy as well. So that's one way to guarantee both adequate intake for you and baby. The sources of iron is going to be lean meat, seafood, nuts, beans, dark leafy vegetables, and fortified grains. Additionally, calcium and vitamin D are going to be very important for the baby's bone development and teeth. Also, it's going to be important for you because if you don't take enough calcium in, then your body is going to protect the baby, and by doing that, they're going to take the calcium from your bones, causing your bones to become depleted. And so adequate intakes can make sure, before pregnancy and during pregnancy, can make sure that both you and baby are getting what you need. Food sources of both of these are going to be milk, yogurt, cheese, and for calcium, you can get that from kale, broccoli, spinach, as well as milk alternatives, fortified milk alternatives like soy milk, almond milk, coconut milk, and those options as well. The last of the main important nutrients I'm going to talk about today is DHA, and this is a essential fatty acid that they found that is very important in helping the baby's brain develop properly. And food sources of this are going to be fatty fish such as tuna, salmon, sardines, or mackerel. One of the things we do have to watch out for is often those fatty fish contain mercury, which can also affect brain development. So we want to limit the intake of fatty fish to about 12 ounces of fish per week. Also, another option if you don't like fatty fish or you don't feel like you're going to get enough in your diet is an omega-3 fatty acid supplement. However, this is something I would want you to talk to your doctor about as well. One of the questions that I often get is, can I eat for two? I wish that were the case, but unfortunately it's not. You do get a little bit of extra calories throughout pregnancy, but definitely not going to be allowed to double our intake. So in the first trimester, there's actually no extra calories needed. And then in the second and the third trimesters, you'll need about 340 extra calories a day, and then the third 450 extra calories a day. And I usually say in doing this, trying to make sure that with those extra calories that we make them what I call nutrient-dense foods. So choosing some of those foods we talked about earlier, like your fruits and your vegetables and your whole grains and your healthy fats like peanut butter, almonds, avocados, and things like that to help fill in those nutrient gaps. Another big question I often will receive is how much weight am I supposed to gain throughout pregnancy? So this will depend on a variety of things, one of them being what your weight is before you become pregnant. So if you're in the normal weight range for your BMI, anywhere from 25 to 35 pounds is appropriate. If you're in the overweight category, 15 to 25 pounds would be appropriate, but also one thing to consider is if you're carrying twins or multiple babies, your weight gain demands will be higher than those of just a single pregnancy. And lastly, I want to talk about is gestational diabetes. And this is diabetes that is diagnosed during pregnancy. It's caused by high blood sugar levels that can impact your pregnancy and your baby. It can often be managed by a healthy diet and exercise. And gaining the appropriate amount of weight, exercise, and healthy eating can all help prevent gestational diabetes from occurring during your pregnancy. Watching the types of food that we eat can help ensure and improve blood sugar levels. So foods that we eat contain protein, carbohydrate, and fat. What's going to affect our blood sugars the most is going to be the carbohydrates. And so carbohydrate foods are going to include pasta, rice, cereal, your starchy vegetables like potatoes, peas, and corn, beans, milk, yogurt, and some milk alternatives, fruit and fruit juice, and then sweets and sugary beverages. And just some general tips on managing gestational diabetes would be, first and foremost, trying to avoid sugary beverages such as sodas, sweet teas, juice, sports drinks, coffee drinks. Limiting sweets, so your cakes, cookies, candies, ice cream. Trying to eat regular meal times. And usually we aim with gestational diabetes and pregnancy to eat 3 meals a day and have 2 to 3 snacks a day in between. We also want to pay attention to portion sizes, and we want to try to eat a similar amount of carbohydrates each meal. We also want to make sure we're including a variety of healthy foods, just like we talked about before. So fruits, vegetables, whole grains, lean proteins, your low-fat dairy products, and your healthy fats. And another piece that I think we often forget about with gestational diabetes is the importance of exercise. And so it can really help improve blood sugar levels. Exercise, the number one fuel for exercise is going to be carbohydrates. So with that, we can lower our blood sugar levels. Beginning an exercise program before pregnancy, again, can help decrease our risk for developing gestational diabetes. And aiming for 20 to 30 minutes of moderate intensity exercise most days of the week would be the goal. And our ultimate goal would be trying to get at least 150 minutes each week. But just as a caution, talk to your OB/GYN before starting any exercise program, just to make sure that you're safe to do that during pregnancy. And lastly, it's never too early to develop healthy habits for both you and baby. It's going to promote a healthy pregnancy and a healthy start for you and baby, and also continuing to live this way and eat this way and have that healthy lifestyle can help set an example for baby even after they're born and throughout your lifetime and their lifetime.